Oh, well, hey there. Welcome back. And I appreciate you being here, allowing this community to keep growing stronger and stronger for hemorrhoid sufferers like you and myself. Yes, you heard that right. I've bottom end issues too. We need to grow together as a community, bring these issues to light, get our recoveries back on track. And what's really cool is what you guys are also doing is challenging me. Because yes, these concepts I'm bringing up are super difficult to explain. And you guys are saying like, Dr. Chung, don't just talk about it, don't just use your hands, use models, like show us. And you know, I bought some models, but I look at the videos, they're not that good. And I don't want to just bust out a textbook so you guys can be bored to death. So here we go, another dimension of my creative brain is coming into play, and we're gonna play with Play-Doh here. And so I really hope you guys enjoy it. Let's get to the topic, which is going to be LIS, lateral internal sphincterotomy. It's something that you read about all over the net because it's most commonly used for anal fissures. But we're going to show you, or I'm going to show you, how the surgery is done, some basic anatomy. We're going to use it all with clay. Okay, so let's get started. And I'm so excited to show what I have for you. What is the LIS in brief? And altogether class, it is the cutting of the internal sphincter muscle in surgery, usually about 1 centimeter. Now let's talk about our anatomy. The first player here is the external anal sphincter muscle here in green. And this is the outside muscle ring. The inside muscle ring is this light blue, and you guessed it, they fit inside each other just like that, okay? And when you are looking at the outside of your butt, so this is on the outside of your skin here, you'll notice that the external anal sphincter muscle is actually taller than the internal sphincter muscle. And this will be important later on in other videos, but I just want you to notice that today. This is obviously not done to scale, but to show relationships. When you put it on the paper, I want to orient you here. We've got the tailbone on the back side. We have your right side of your body and the left side of your body here. And what else are we missing? Oh yeah, we need to draw our handy little fissure. So here's our red cut. Ouch, right, guys? It bleeds, it causes razor sharp ripping pain usually. When we have patients in the surgery, okay, we are identifying all of these structures. We of course will look inside the anus. Inside the internal muscle live the hemorrhoids and also the fissure. But we're looking for anything suspicious there as well. After we inspect your body, which is in other words called the examination, we can then proceed with the procedure. And what we are looking for is the intersphincteric space. And intersphincteric means we are looking for the space in between the internal and external muscles. Next, we of course go to the left side. It's usually done on the right. Why? Because a lot of times people may have a hemorrhoid on the right side here, marked by my pen. And I know this anus is a lot bigger than real life, but this big hemorrhoid here can get in the way of doing the surgery on the right side. So that's why we go to the left. Usually there's not much action here and we can do the surgery safely. Then the next step in the procedure is to make our cut on the skin in order to be able to cut the muscle. So if my hand is the skin, we're going to make the cut over the skin here, right over the place where I talked about the intersphincteric space. Once that's open, now we can see your internal anal sphincter, and I will then cut it in surgery, like so, like I'm doing with my pen here, okay? When I flip this over, you're going to see that there's a gap in there. Now the circle is no longer continuous, it's broken there. When you have a muscle that's no longer to touch each other again, the muscle squeezes on its own, but is no longer able to touch each other. So there's that break and that muscle's now loosened. The theory behind this surgery, of course, as you know, is if you can release some of that tension the muscle is doing, then the muscle cannot squeeze so hard to choke out the blood supply and allow that fissure cut to heal better. But what about that fissure? Well, some surgeons will actually try and do a cleanup job of this fissure. So they call that the fissurectomy. I know this is like a big worm of red, but it's going to be essentially flattened out like this because they're going to cut off any skin tags, any of those kind of raised edges on the side of here where there may be skin or maybe some small hemorrhoids, and the fissure will turn out flat again. The final part of the surgery is, of course, that skin cut that we made will be stitched up. Some doctors may not even stitch it up at all. And then we send you off to recovery and, of course, wake you up from the surgery. So that, in brief, is the LIS surgery. That's how you do it. Now you can go do it on yourselves. I'm kidding, of course, but I hope that that was very informative for you and helped you understand and see what was done to you in your surgery or what you're going to talk about with your surgeon. Definitely let me know your feedback on how this was done. I'm always trying to do things better all the time. And again, I hope you and wish you well on your recovery. Take care. Bye-bye.